Tonight's webinar is the third on our ongoing community series forum. Our topic today is shelter intake. This meeting will be recorded and it will be uploaded at a later time to our YouTube channel. We also want to just thank everyone for the flexibility following the rescheduling of this meeting while our facility gets our fire system control panel replaced. Before we get started, I want to just briefly go over how tonight's meeting will work so that everyone knows what to expect. We will begin with the presentation covering today's topic, which is shelter intake. Once that's complete, we will answer some of the questions that were submitted in advance or submitted into the Q&A function, which you should all have access to. Since many of the community members have asked very similar questions, some questions may have been combined to allow more time for in-person questions. We will then take questions from you all here on the topic of shelter intake. If time permits after that, we will open the floor for additional questions not related to today's topic. When we reach that point, we will ask you just to raise your hand using the raise hand function on Zoom, and then we will call on you and unmute you. To give as many people the opportunity to participate, we ask that each person ask one question at a time. If there is time remaining after everyone has an opportunity to participate, we will gladly come back for additional questions. Finally, we just ask that everyone be respectful to one another. I mentioned during our first webinar that we're going to have different opinions and that we're not all going to agree at the end of this meeting, and that's okay. We still welcome different viewpoints, and we just want to maintain an environment where everyone can hear, participate, and feel safe doing so. Our goal tonight is to share information, answer questions, and have a meaningful conversation with the community. So with that, we'll get started, and we'll get started with Monica. Go ahead, Monica.
Here I am. Welcome, everyone. Thanks for joining us for this evening's forum for July. And we hope that you find this information very helpful. There's a big process that went into it and a lot of great information to share. So without further ado, I'd like to go ahead and welcome our presenter this evening, which is Mallory Kinsman.
Thank you, Monica, and it is great to be here. Thank you, everybody, for joining us today. My name is Mallory Kinsman, and I am one of the shelter operations supervisors here at San Jose Animal Care and Services. I have proudly served our community for about 15 years. I began my career as an animal control officer before being promoted to captain of the field services unit. Today, I serve as one of the shelter operations supervisors, where I oversee daily operations of our shelter and work to ensure that we provide the highest level of care for the animals and people in our community. My years in the field gave me a very unique perspective that has been really invaluable in my current role. Responding to calls throughout our community, it really allowed me to understand where the greatest needs exist, the challenges our residents face, the critical role that the shelter operations play in supporting both people and animals. And that firsthand experience continues to influence the decisions that I make even today, helping ensure our shelter remains responsive, compassionate, and focused on providing the right services at the right time. As an animal control officer, I handled a wide variety of calls. This could include emergencies, stray animals, neglect and abuse investigations, confiscations, and animal welfare concerns. Some of the most memorable cases involved large-scale surrenders, including removing more than 100 chickens from a single property, rescuing 60 cats living in inhumane conditions, and responding to cases involving numerous dogs and puppies that desperately needed care. Those experiences reinforce just how important it is to have a shelter with the capacity and resources to respond when animals need us the most. I'm grateful to be part of this organization and that we can provide life-saving care and give these animals second chances. Today, my focus has shifted from responding to emergencies in the field to ensuring our shelter is prepared to meet the needs of both our community and the animals that depend on us. I am passionate about growing programs that improve animal welfare, supporting our dedicated staff, and balancing compassionate service with responsible animal shelter operations. I appreciate the opportunity to be here today to share my experiences and discuss the important work our agency does on a daily basis. So, a little bit about San Jose Animal Care and Services. In fiscal year 25-26, we averaged 936 animals entering our shelter each month. That is an incredible number. We have the largest intake in Northern California. Our animals not only come through our intake department, if you're familiar with us here, our intake department is located in the front of the shelter, but they're also coming through our field services unit, which I told you a little bit about with my previous experience. We'll move on to the next slide here. So when we talk about our core values, it's important to break them down. Extraordinary care of the animals. Our first responsibility is always the animals. From the moment they arrive, we ensure they're handled in a safe manner, treated with compassion, and receive the care they need. We pay attention to their medical and behavioral needs, minimize stress whenever possible, and advocate for their well-being throughout their stay. Outstanding care of each other. Providing excellent animal care starts with supporting each other. We want to support our teammates, communicate professionally, and be willing to help. We are most successful when we work together. Exceptional community experience. For many people, intake is their first impression of the shelter. Whether someone is surrendering a pet, bringing in a stray, or looking for assistance, we have an opportunity to provide a positive experience during a difficult time. We listen, show empathy, communicate clearly, and work to offer solutions while maintaining shelter policies and capacity for care. Meaningful and accurate data reporting. Everything we document matters. Accurate records help us track animals through their pathways and provide statistics that are valuable for future decisions. One team, one shared purpose. Although we have different responsibilities, we all share the same mission. From intake, medical, admin, and field, we all look and work toward improving outcomes for animals and serving our community. Success comes from collaboration, accountability, and recognizing that every role contributes to our overall mission. Go to the next slide. Now we're going to get into intake. So we're going to start with aligning intake with capacity for care, C for C. Capacity for care means we only house the number of animals we can properly care for. It's not simply about available kennels, but it's about having the staffing, medical resources, housing, enrichment, and time to meet each animal's physical and behavioral needs. When we exceed this with our capacity, stress increases, length of stay increases, and positive outcomes may decline. Per the Association of Shelter Veterinarian Guidelines for Standards of Care in Animal Shelters, operating beyond an organization's capacity for care is unacceptable practice. When shelter populations tax the organization's ability to provide care for their animals, living conditions worsen, and a population health and well-being are compromised. It also states that working to maintain the population within the shelter's capacity for care has been linked to decreased length of stay, decreased disease and euthanasia rates, and increased live outcomes. Policies and protocols must be in place to ensure an organization operates within its capacity for care. So intake staff play a key role by helping balance community needs with the shelter's ability to provide quality care. Managing intake. Managing intake means being intentional about how each animal enters the shelter. Rather than automatically admitting every animal immediately, we assess each situation to determine the best course of action. This may include scheduling appointments, providing resources that allow an animal to remain safely home, or admitting the animal immediately if there is an emergency. Effective intake management ensures shelter resources are available for the animals that need them most. Initiating the pathway planning. Pathway planning begins at intake. As we gather information, we should already be considering animals' most appropriate path through the shelter. Is this a healthy stray that we can quickly return to the owner? Does the animal need immediate medical care? Is behavior support needed? Could the animal be a candidate for foster, rescue, transfer, adoption? Starting this plan early can greatly reduce the length of stay and improve outcomes. And also community safety net. The shelter is one part of a larger animal welfare system. Our goal is to support people in keeping their pets safe in their homes whenever possible. Intake staff provides resources such as pet food assistance, resources for lowest cost veterinary care, temporary housing options, lost and found resources, and responsible rehoming tools. By connecting people with these resources, we can often solve problems without requiring shelter admission. And then we get into the 4 R's: the right time, the right place, right care, right outcome. The 4 R's provide a framework for decision making. The right time. Admit animals when they truly need shelter services. The right place. Is the shelter the most appropriate location for this animal? The right care. Provide care that matches the animal's needs. Right outcome. Focus on achieving the best possible outcome, whether that's returning home, remaining safely in the community, rescue, transfer, foster, euthanasia, or adoption. Next slide, please. What is managed intake? So managed intake is a strategy that helps us provide better care by making thoughtful decisions about when animals enter the shelter. The goal is not to keep animals out, but to ensure they enter the shelter only when it's the best option. So what does that mean? We're going to exhaust all appropriate alternatives first. Before admitting an animal, determine if there's a safer option that allows the animal to remain outside of the shelter. This could include providing resources for someone to hold on to a stray animal while looking for the owner, providing pet retention resources, or scheduling an intake appointment. If shelter admission is the best option, we will admit the animal. Prioritizing urgent cases is also important. Managed intake allows us to reserve space and resources for animals that need immediate shelter services. This could be sick, injured, animals in danger, cruelty cases, or animals who cannot safely remain where they are. Non-urgent cases can often be managed through appointments or alternative resources. Using resources effectively. Shelter space, staff time, veterinary care, and enrichment are all limited resources. Every additional animal requires daily care, cleaning, and medical attention, and behavioral support. By managing intake, we ensure those resources are available for every animal already in our care. And improving animal welfare and outcomes. Overcrowding increases stress, possibly disease transmission, behavioral decline, and length of stay. Managing intake helps maintain capacity for care, allowing animals to receive individualized attention and increasing their chances of returning home, being adopted, or transferring successfully. Next slide, please. So I discussed what managed intake is. So let's talk about what managed intake is not. That is very important. There are many misconceptions about managed intake. It's important to understand what it is and what it is not. Managed intake does not mean allowing sick or injured animals to suffer. Animals that are sick, injured, in distress, or experiencing emergencies are prioritized and admitted immediately. Managed intake is designed for non-emergency situations, not emergencies. Managed intake does not mean allowing sick or injured animals to suffer. Animals that are sick, injured, in distress, or experiencing an emergency are prioritized and immediately admitted. Also, managed intake does not mean ignoring public safety. Dangerous dogs, bite cases, cruelty investigations, and animals that pose a threat to people or other animals are handled promptly. Public safety remains one of our highest priorities. Managed intake does not mean forcing people to keep stray pets they cannot care for. Our role is to explore available options and provide resources when appropriate. If those options are not safe, appropriate, or successful, we schedule intake or admit the animal based on its needs in the shelter's capacity. Managed intake, this is a very important point. Managed intake does not mean helping fewer animals. In fact, the goal is to help more animals by using shelter resources strategically. When we avoid overcrowding, animals receive better care, experience less stress, stay healthier, and have improved outcomes. At the same time, community-based solutions allow us to assist pets and people without requiring shelter admission. Next slide, please. So what is the intake process like? Well, the intake process is designed to ensure every animal receives the appropriate level of care while allowing us to manage our capacity for care. Every intake follows the same decision-making framework. Appointments may be scheduled for non-urgent cases. This allows us time to prepare space, staffing, and resources before the animal arrives, reducing stress for both the animal and the shelter. Urgent cases prioritized. Animals that are sick, injured, and at immediate risk, involved in cruelty cases, or present a public safety concern are evaluated and admitted as quickly as possible. I wanted to provide some examples of what intake staff handle on a daily basis. We had a dog who was found with all limbs bound by electrical wire, hit by car animals, a family whose dog attacked another person in the household, kittens in a crate that were dumped inside of a dumpster, stray dogs with parvo. This is just a handful of situations that the intake staff have to ensure that they're handling correctly and ensuring that those animals receive timely care. Processing the animal. Once admitted, the animal receives a complete intake evaluation. This includes collecting owner or finder information, documenting the animal's history, if we have history, or even knowing how the animal was with the finder is helpful information for us. Performing an identification check for tags and microchips, obtaining a picture, providing vaccinations, assigning housing, and entering accurate records into the shelter management system, which is known as Chameleon. Pathway planning. Intake is where we begin planning for the animal's outcome. Based on the information we gather, we identify the most appropriate pathway for the animal at that time. Starting this process immediately helps reduce length of stay and improves outcome. One of the most challenging parts of working in intake is balancing the needs of the animal the finder or the owner, the community, and the shelter. There is rarely a one-size-fits-all answer. We also encounter situations that fall outside of our normal jurisdiction. While our standard practice is to refer people to the appropriate agency, there are times when we need to look beyond jurisdiction and focus on the immediate welfare of the animal. A common example is owner-requested euthanasia for critically ill or severely injured animals. We receive these requests because some agencies do not offer the service, have limited availability, or the cost is beyond what the owner can afford. If an animal is actively suffering, we will evaluate the situation and, when appropriate, provide humane euthanasia to prevent unnecessary suffering. Another situation, just last week, a finder brought us a puppy suffering from a really bad skin condition that needed care. Although the puppy was found outside of our jurisdiction, the responsible agency declined to accept the animal because the finder did not have a California ID. We attempted to contact the agency and intervene, but due to the puppy's urgent medical needs, we made the decision to intake her so she could receive the care she needed without further delay. This just shows that why it's so amazing working for San Jose Animal Care and Services is just there are situations that you don't hear about of going above and beyond. Intake is one of the most difficult jobs in the shelter. I'll keep saying that. Every day you are making decisions that require compassion, critical thinking, and sound judgment. You are balancing the needs of an individual animal, the needs and emotions of an owner or finder, public safety, and the shelter's capacity for care. This is very important. Not every decision will make everyone happy, and some conversations are difficult. Our responsibility is to make decisions that are ethical, humane, and in the best interests of both the animals and the community we serve. Next slide, please. Pathway planning. We talked about pathway and intake, so this gives a little bit more information about that. So this slide illustrates one of the most important concepts in animal sheltering, which is pathway planning. Intake is much more than accepting animals through the door. Every decision we make at intake influences what happens next. As a municipal shelter, we accept animals from our jurisdiction, sometimes out of our jurisdiction, regardless of breed, size, age, medical condition, and behavior. Unlike many private organizations, we do not have the ability to limit intake based on these factors. When an animal arrives, our first responsibility is to gather as much information as possible. We collect the history from the owner or finder, perform a visual assessment, document medical and behavioral observations, scan for a microchip, research identification if there's a microchip, hopefully find an owner that way, and determine whether the animal has any immediate medical or public safety concerns. The information that we gather during those first few minutes is what determines that animal's initial pathway. So with the initial assessment, intake staff are asking themselves several important questions. Is this animal healthy, or does it need immediate medical attention? Is this animal displaying normal behavior for the situation, or are there behavioral concerns that need additional evaluation? Does this animal have an owner that can be located? Would this animal benefit from foster care? Is there a rescue partner that may be better equipped to handle this animal's needs? We have our outcomes. Our goal is always to achieve the best possible live outcome while ensuring humane care and public safety. Adoption. Healthy animals or animals that have completed medical treatment or behavioral assessment become available for adoption. Our goal is to place animals into homes where they can be successful long-term. We have to think about our average adopter and what level of experience they can handle. Return to the field, RTF, also known as RTF. For eligible, healthy community cats, return to field is often the best outcome. This includes cats who are then sterilized, which is also known as spay and neuter, vaccinated, ear-tipped, and returned to the location where they were found. Return to our owner, RTO. Returning lost pets to their families is a big priority. This is why microchip scanning, checking for tags, and gathering accurate information is so important at intake. On a side note, I did want to mention, Nextdoor has been a very helpful platform for reuniting pets with their owners. And a friendly reminder, please make sure that your pet is microchipped and that the information with the microchip or on the microchip company is up to date. We often find that phone numbers that we call are disconnected or addresses are old. So please make sure to update your pet's microchip if you have information if you haven't done that in a while. Rescue. Some of our animals have specialized medical or behavioral needs that can be better supported through one of our rescue partners. Rescue partnerships expand our capacity to save lives. Euthanasia. Although it is never the desired outcome, euthanasia can be the most humane option. This could occur when an animal is suffering, has severe, untreatable medical conditions, or presents significant public safety risks that cannot be safely managed. These decisions are made carefully, collaboratively, and with compassion. We discuss as a group when making these decisions, and we take all information into account. Intermediate pathways. Many animals don't move directly to an outcome. Instead, they enter one or more intermediate pathways. This could be foster. One of the best ways to support our shelter is through fostering. If you're not a foster yet, please sign up. Opening your home, even for a short time, helps reduce stress for animals, increases their chance for positive outcomes, and allows us to help even more animals in need. Animals may enter foster for different reasons. They're too young, recovering from illness or surgery, pregnant or nursing, experiencing kennel stress, or simply need a quieter environment. Foster homes often improve both medical recovery and behavioral well-being while freeing valuable kennel space. And then we have medical pathway. Animals that are sick or injured are evaluated by our medical staff. This may include diagnostics, medications, surgery, isolation, or supportive care. Once medically cleared, the animal may become available for adoption, transfer, or rescue, or return to its owner. Behavior pathway. Some animals need additional behavioral evaluation or support. We may see fearful behavior, barrier reactivity, stress-related behaviors, or true behavior concerns. The behavior team develops plans to reduce stress, improve adaptability, and determine the safest outcome. It is important to remember that behavior at intake is only a snapshot. Many animals are overwhelmed and do not show their true personality during those first few days. Pathways are not permanent. You'll notice a lot of lines on this slide. One thing I would like you all to notice is the arrows move in multiple directions. An animal's pathway is not permanent. A dog may enter through medical, recover, then move to behavior for additional support before ultimately being adopted. A kitten may begin in foster, return for surgery, and then go up for adoption. An animal initially placed on a behavior pathway may improve significantly once it has had time to decompress, and again, up for adoption. As we gather more information, the pathway evolves. Next slide, please. So we also need to talk about at-risk animals. So we're going to start with behavior. When people see a dog barking, growling, lunging, or hiding in a kennel, it's easy to assume that the animal is aggressive or unadoptable. However, behavior inside a shelter can be different than behavior in a home. Many animals experience what we refer to in the industry as fear, anxiety, and stress, also known as FAS. Animals experience FAS you may see the following as far as dogs excessively panting, refusing food treats, shut down, avoiding interaction, trembling, offensive and defensive behavior. This is why our behavior team doesn't make decisions based on one single observation. We evaluate animals over time in different environments and after they've had an opportunity to decompress. Aggression versus fear. It is also important to understand that not all aggressive looking behavior is true aggression. Sometimes an animal is simply terrified, and there are other times when we have dogs who will lunge and try to bite staff. Our job is to determine whether the behavior, is fear-based and likely to improve, or whether it represents a genuine public safety concern that cannot be safely managed. Public safety. As much as we want to save every animal, we have a responsibility to protect our community. If an animal has demonstrated severe aggression that creates a significant risk of causing serious injury, we must carefully evaluate whether that animal can be safely placed. These decisions are never made lightly. They involve multiple departments and reviewing history and behavior. Again, not one person is making this decision. This is a group discussion. Medical risk. The second area is medical risk. Many animals arrive with illnesses or injuries that are treatable. Others arrive with conditions that require weeks, months of recovery before they can be ready for adoption. Some animals are suffering, and euthanasia is the kindest option. Prognosis. When discussing medical cases, one of the biggest factors we have to consider is prognosis. Prognosis simply means the likelihood that an animal can recover and enjoy a good quality of life. Some animals have an excellent prognosis with treatment. Others may have illnesses that are terminal or cause ongoing suffering despite extensive medical care. Treatment. Treatment is also about balancing what is medically appropriate with what is humane. Not every condition can be fixed with surgery or medication. Some animals require months of intensive care, repeated procedures, or lifelong management. As a municipal shelter, we must make decisions that consider the individual animal's welfare, available medical resources, shelter capacity, and our ability to continue helping the thousands of animals that come through our doors every year. Multiple medical issues. Sometimes animals don't arrive with just one problem. Each condition by itself may be manageable, but together they may significantly reduce quality of life. These are often some of the most difficult cases for our medical team. We evaluate because we aren't just treating one issue. We are looking at the entire picture. At the same time, we have to responsibility to make compassionate, evidence-based decisions that balance the welfare of the individual animal, the safety of our community, and the capacity to care for every animal that enters our shelter. Every decision is made with the goal of providing the most humane and appropriate outcome possible. Next slide, please. Now we get into the community safety net. We have the Finder program. So the Finder program allows a person who has found a dog to hold on to the dog during the stray hold period. This allows for potentially quicker placement and shorter length of stay. The dog will receive it. The Finder will bring the dog to us. The dog will receive a health check and vaccinations prior to leaving with the person who found it. The dog will be scanned for a microchip. We'll also impound the dog into Chameleon so that the dog is visible online for potential owners looking for their dogs. A later date will be provided after the stray hold period for the dog to return to the shelter and then be sterilized, spay and neuter, and hopefully go to adoptions. So just a quick turnaround. Leave them be, fix at 6. Nursing kittens. We all know, well, and if you don't know, that's fine. But nursing kittens have the best chance of survival when they remain with their mother, whenever it's safe to do so. We encourage healthy kittens to stay with their mother until they're approximately 6 weeks or weigh at least 1.5 pounds. If kittens cannot safely remain with their mother, they may qualify for our Fix at 6 program, which is an emergency foster. Kittens will receive a health exam and vaccinations. Foster families are provided with education and supplies needed to care for these kittens successfully, and can schedule their spay or neuter surgery once the kittens reach 1.5 pounds. Kittens that weigh between 1.5 pounds and 2 pounds may be admitted to the shelter if there is space. When capacity is limited, they may remain in this Fix at 6 program until space becomes available. And then once we can get them in for surgery, right to adoption floor. Responsible rehoming. Responsible rehoming is another important tool that helps keep healthy pets out of the shelter. Many pets can be successfully rehomed with family members, friends, coworkers, or other trusted individuals. Some owners are hesitant to ask for help because they worry about being judged. We encourage them to focus on finding the best possible outcome for their pet. When a safe and responsible home can be found, it is often less stressful for the animal than entering a shelter. Reuniting pets in their community. One of the best ways we can increase reunification is empowering finders to actively search for an animal's owner before bringing the pet to the shelter. We encourage finders to check for ID tags. This happened to me just probably 2 weeks ago, I believe it was. I had a lab end up on my doorstep. Checked for tags. Next thing I did, which is important, is took the dog for a walk. We had a leash, walked through the neighborhood, talked with the nearby neighbors, see if anybody knew the dog, and just hope for visibility and that there was an owner driving around looking for their dog. Also, have the pet scanned for a microchip at a shelter or at a local veterinary clinic, and post found pet flyers as well in the neighborhood. These simple steps can often reunite pets with their families much faster than bringing them into the shelter. And I will say that walking around this beautiful lab that I had, I did encounter the owner and there was a successful reunification. Retention for behavioral resources. Behavior concerns are one of the most common reasons pets are surrendered. Before surrendering a pet, we encourage owners to work with qualified trainers and their veterinarian to address the issue. given that the behavior is not an immediate public safety risk. If it is a public safety risk, then we will discuss and most likely take in the animal depending on the situation. And if it is a safety risk, take them in. Financial resources. Temporary financial hardship should not result in a pet losing its home. We offer several resources to help families keep their pets, including our pet pantry, which is held on the first and third Wednesday of each month for eligible residents who are within our jurisdiction and whose pets are licensed and sterilized. We also provide information on financial assistance for veterinary care and low-cost spay and neuter services. Housing challenges. We hear this a lot in intake. Housing restrictions have become increasingly common for pet surrender. We frequently assist residents whose landlords no longer allow pets, or those who are moving into housing with breed or pet restrictions. Large breeds are particularly affected. When possible, we work with the owners to explore alternatives. Next slide, please. So before we go into questions, as I close today, I want to leave you with one final thought. Compassion fatigue is real. Every day, our staff makes incredibly difficult decisions, often carrying the emotional weight of situations that most people will never see. Yet every single person who walks through these doors comes to work for the same reason, for their love of animals. They chose this work because they want to make a difference, even knowing that not every day will have a happy ending. The challenges we face are not just shelter challenges, but they are community challenges. Pet overpopulation, housing restrictions, access to veterinary care, financial hardship. This all contributes to the number of animals that need our help. While we work tirelessly every day to provide compassionate care, we cannot solve these issues alone. Every decision we make is guided by one question: what is in the best interest of the animals and the community we serve? Sometimes those decisions are difficult, but they are always made with compassion, professionalism, and commitment to doing the most good with the resources we have. Imagine fewer animals entering the shelter because more families had access to resources. Imagine every healthy animal having a foster home while they wait for adoption. Imagine every lost pet finding its way home because neighbors work together. If you have room in your home, consider fostering. If you're ready for a lifelong companion, adopt. We have plenty of lovely animals up for adoption. If you have time to give, volunteer. If you can't do those things, be an advocate for responsible pet ownership and share what you've learned today with others. Every act of kindness matters. Every person who gets involved creates another opportunity for an animal to be safe, cared for, and loved. Together, we can build a community where fewer animals need our shelter because more people are helping before they ever got there. Thank you for your time, your compassion, and for caring about the animals who all depend on us.
Thank you, Mallory. Just jump in right into the questions. We have one question from our guest submitted to the Q&A is, can you share an example of a behavioral pathway for dogs that are stressed?
Yes, so dogs that are experiencing stress, we have different, sorry, let me go here real quick. Sorry, I need to put my screen up so I can see. We have different what we call care packages, and these care packages give us a sense of what we're looking at. So when a dog presents with certain behaviors, we're going to refer this care package and see what we can do to help that dog. This could be, I'm not sure how many of you have been here recently, but we have these really neat kennel panels that have been put on our kennels. And it's more of a visual barrier for those that are experiencing stress. And we have one on the front and the back kennel. And what it does is it gives the dog a choice if they want to be visible and seen, or if they're more shy and would rather be hidden. So by working on these care packages, we have seen improvements with dogs, which has been great. Our team loves when they can report back all the differences that are seen, but that's just an example. Thank you for the question.
Awesome. Another question is, what is offered for pet retention? What is offered for pet retention resources?
So pet retention resources, what we try to do is if somebody is, let's say it's a financial hardship, and they are saying that they can't care for their pet because they don't have the money for food or something along those lines, we can help provide those resources to them. We also, if it's something that it's challenging when it's a landlord decision, right? So if retention is, we always are going to try to keep animals in their home. Oftentimes we hear people say, I don't have the time. The dog's just doing its own thing in my house and going into the backyard, but I'm never home. I don't have time. And it's about taking the time to educate them that even if you feel you don't have the time for that animal, which in reality, they're just saying they're going to work and they're coming back home, the stress that the dogs is going to experience here coming into the shelter is so much greater. And that pet would much rather prefer to be in a familiar place with people who care. And so we try to educate people that they don't have to be with the animal 24/7 and that it's okay. So just trying to have those conversations.
We have a question regarding the first come, first served TNR, and that is cats that are who don't make it into our opening slots. Are those cats being tracked, and what's included in the data reported?
So we are working on having that information tracked, but on the first come, first serve, if they don't make the final cutoff for those surgeries, then oftentimes we're providing vouchers. And we've been very successful with being able to provide those vouchers to anyone who is left. But we will definitely work with those who are coming in for TNR and getting them in.
Thank you. And there's a question also with TNR, and that is the first come, first serve program going to continue in August?
Yes. Oh,
Can I, sorry, jump in real quick. My camera's not working. It's Kiska. Hi. So in August, we only have 2 days that we're doing TNRs on Tuesday. And so we'll likely try to fill those with the overflow from Mondays. Like Mallory said, with the vouchers for people that can't get in. But we anticipate in September doing all Tuesdays in September. So with the exception of 2 weeks in August, yes, that we'll do them through September.
Thank you, Kiska. I have another question here is, they'd like to hear what happens for animals who aren't intaked by the shelter. What do we communicate to the concerned citizen regarding a stray animal on the streets? Or what about when animals neglect takes place at a home? A example being they're kept outside without shade, food, or water.
okay. So I would definitely say if there is a concern for animal neglect and you're concerned that they're not receiving proper care, we have an animal services unit. And I would encourage you to reach out to them and let them know what your observations are and what your concerns are. They can always send an officer out there to just verify. It's okay if everything turns out to be okay when they go out, but at least we know that the animal's okay. We provide information on licensing, so it's a win-win. And yeah, and I'm sorry, Gilbert, the first part of that question?
Give me 1 second, go back to the neglect and about let me get back to you on that, Mallory.
Oh,
Let's ask the
okay, I'm sorry.
next
I'm sorry.
question. No worries.
We'll get back
We
to
have
it.
a question saying when a pet is diverted, what information is logged and how do we keep contact with the individual?
Yeah, excellent question. So I actually was going through our intake logs. We do keep track of every interaction in intake. It's also a good way to see how truly busy intake is. But I'll reference one day that I looked at, and it was June 30th. And trying to remember based off memory, 19 strays had come in. That's not including everything that came in through the day for intake, or as far as like questions, TNR, things like that. 15 were accepted. The 4 that weren't, one was outside of our jurisdiction, it was not an emergency, and 3 others were TNR related. We have been taking in a lot of these animals, especially dogs. Looking through the log, there's just accept. So we track what type of animal, is it a dog, cat, whatever the case may be, if we accepted it. If we did not accept it, we are also putting notes in as to why. So, for example, one of those was a cat who was already TNR'd. Okay, wonderful. Great. The cat was already TNR'd. Let's get them back to where they came from. So we are looking at that information. It is great information, but as far as, I don't want anyone to think that we're just kind of telling everybody you're on your own with these found dogs. We are working with them.
Okay, sorry, Mallory. Going back to the other question, the individuals, what do you tell a person who's concerned about a stray dog?
I'm not sure about the question for what it involves, but if you found a stray dog, or if you're concerned about one running around, if there is a stray dog that, let's say, I'm not sure if this was the idea, but if it was running around and you weren't able to catch it, you can always contact our field services unit. They can do a patrol of the area and see if they're successful. And if you find a stray, then everything that I kind of listed within that presentation regarding trying to find an owner, oftentimes animals, unless they're dumped, which unfortunately is a reality, they're found within close proximity of where they live. So by walking them around, checking for ID, things like that.
I have a question regarding rescues, asking why are we having less animals being sent to rescue?
Okay, no, I appreciate that question. So I can tell you, because I myself have been actively involved in reaching out to rescues. Rescues are facing the same challenges we are. There's a big demand and need for placing these animals, and unfortunately, not enough resources. So I'm just speaking personally right now about my encounter, or my situation. I reached out to numerous rescues, even out of state. And what I would hear back is, one, we're either focusing on our immediate area because they have a great need as well. Because remember, we are not an isolated shelter here experiencing this. This is happening nationwide. So there is a huge need for rescues. Or they said, we don't have any fosters available. That's really challenging. They need a foster in order to pull. They're just full. So unfortunately, despite a lot of reaching out, they're just not in a lot of rescues are not in a position to pull. We're always here if they want to pull from us, and we're hoping that things get better for all of the shelters and the rescues, because I know everybody is working so hard, and hopefully there will be some relief in our future.
In that same regard, we have a question that's what is the shelter doing to re-engage with rescue partners?
So we actually are holding a monthly rescue meeting, which if you're a rescue, please reach out to us. We'll get you set up with the meeting invite. But we're having a rescue meeting monthly, and that's really to see how the rescues are doing, explain what our needs are as well as far as animals at the shelter, give a sense of how many animals we have. And also, we're presenting a dog and a cat each month that we can show them in hopes of working together to get those animals out of the shelter. But there's a lot of phone calls that are being made trying to talk to them, to introduce ourselves or reestablish ourselves with them, and seeing if we can start a partnership or a transport anytime soon. There's a lot of behind the scenes work that's been happening.
I have a question, Mallory, here. It says, what is our short and long-term plans to address stray cats and feral cats in the community? And also, why are so many friendly cats being returned to the field?
Okay, so this is multiple questions in one. So let me first start with the why are so many healthy cats being returned to the field? I know we all probably have our cats at home that are indoors only, but there is a population that of people who have outdoor cats or maybe just outdoor cats. If you take away their pets, and I'm saying pets because you had mentioned friendly, potentially pets from them, they will potentially go and adopt another unaltered cat, and we're back in the same situation. If you return their cat, now altered, back, they now have an altered cat in that community that they have. So that's another reason. And length of stay for adult cats can be very long, regardless of how friendly. It can be very stressful for adult cats here. So that's a good way to think about it. Short-term, long-term plans for stray cats, I believe was the question, Gilbert. Obviously,
Yep.
so I know we touched about on TNR. So we do have walk-in clinic that we do. We have our 9 Lives transport that we utilize with the voucher program. So there's a lot of great spay and neuter opportunities that are happening, which is super helpful. And of course, we're always looking for opportunities with if there's any veterinarians interested in working with us. I believe we still have a position that is open.
We have a question here that says, do we send out lists of animals in need of urgent rescue to all local rescue groups on a regular basis?
So we actually have a Pet Compass, and I hope you're all familiar with it. If you're not, please sign on and look at it. You can get to it through our website. But the Pet Compass allows you to see every animal here at the shelter, unless it's on unavailable status. This is often dogs who are on investigation holds for field. And you can see animals. You can actually narrow it down by urgent and final animals that are in need of rescue. So rescues can utilize that. We also have, it was really neat, we also have a rescue portal because we used to send out lists, and what we would hear back is that this is a list that's pretty long, it's hard to go through. So with this rescue portal, they can go into each animal and see pictures, get behavior notes, they can get medical history. So everything's in one place and super easy to get. So this has been a very valuable tool for our rescue partners. So they might not be getting an email of every dog that's listed, but on Pet Compass, they can see it and get even more information.
Thank you. We have a question here. It says, how do you identify fearful versus aggressive animals? What fear reduction protocols are used during intake?
So with the fearful animals, we're obviously going to be, we're also looking at the FAS that I discussed, the FAS scores. So some of those behave or the what I had mentioned about, trembling, things like that. Um, if we see that there's a high FAS, we're going to put that animal on vet check for our veterinary team to look at the animal and see if we can provide medications that can help the animal while it's here. So that way we can get ahead of it and then allow them to be on those medications and see if they're helping the animal or if the animal is in fact continuing to experience high FAS and declining. If I've seen it before, but in intake, we sometimes have dogs who are very forward, trying to bite that we have to be super cautious with. Oftentimes, there are sometimes that we'll even have previous history. We know these dogs that come in through the door, and it could have documentation that there's a prior bite. So we just kind of look at the whole picture. And of course, like I had mentioned in the presentation, we're going to give them some time to decompress, but we're going to give that a first initial intake assessment as they come in. Because if they're doing really well, super friendly, we can fast track, those to the adoption floor.
Thank you, Mallory. The question too is, in terms of rescues here, can we promote animals in need instead of passively using rescue searches through a portal? Many photos are old and ages can sometimes be incorrect. So can we actively work with rescue groups?
Oh, of course. Oh, as far as rescue groups working with us,
Yes, I think the question is to actively promote animals in need and reaching out to rescue groups versus them coming to our portal.
of course. So almost on a daily basis, we're reaching out to rescues. And we are all more than willing to send additional videos, pictures, whatever is needed. We will make it happen. And so if we have been working on uploading pictures, especially if they're younger and hopefully not growing up here in the shelter. But so we try to make sure that every animal has a good picture. You're not looking at something behind kennel doors. But yes, we are more than happy to assist rescues with whatever they need. And as a matter of fact, we even actively send a list of animals. We'll say, okay, this rescue tends to pull these types of animals, so let's customize an email that will go out to them saying, okay, we have these ones available. Is this something that you might have the capacity to pull? So we'll tailor our emails to each specific rescue.
Thanks, Mallory. We have a question regarding the need to line up for first come, first serve. Some people are lining up as early as 3 a.m. What's the plan to address accommodating individuals who are lining up that early or who need appointments for first come, first serve Monday?
So I understand that people are getting here earlier. It's we're trying to balance we're trying to make it fair for how we are doing this, and that's why we are also incorporating the vouchers into this, so that somebody who has come in early can still have the opportunity of getting a voucher and getting that cat fixed, as opposed to just leaving. But I've been out there quite a few times, and it's been going very well. Again, I understand that nobody's a fan of waiting in line, but we're not the only shelter that does that. It just tries to make it as equitable as possible, giving everybody an opportunity.
Thank you, Mallory. Monica wants to add to that.
Okay, well, I'm having a little system issue here, but hopefully you can hear me. So yes, as far as those that arrive early to get those services on Mondays, of course, that came into play because we had such a high no-show rate on our Thursday appointment-based system. So we definitely wanted to optimize our surgical capacity and take as many cats as we could. So down the road, of course, we'd like to add more surgery days, which we did for Tuesday to go to 9 lives, and hopefully that will help balance that out. But again, we wanted to maximize any surgical capacity and use those resources.
Sorry, 1 second here. Okay. Regarding Pet Compass, people have logged on and have seen need for rescuing kittens. There's a need and urgent rescue note, but there's no info as to why the rescue is needed. Can you explain that?
Sorry, I was having problems with my audio button. Yeah, so ideally, everybody should have a web note as to why the animal is on needs rescue. So I appreciate that feedback, and we definitely want to make sure everything is that we know is disclosed so that rescues can make the best informed decisions.
We have a question about, is there any volunteer positions for data entry? And if so, who could they contact?
Sorry, it was I couldn't hear that first part.
Sorry, do we have any volunteer positions for data entry?
Monica, I'm not sure.
She's having some technical issues, but we're getting there.
Okay.
So currently, we do not have positions for
So data entry positions, we do not have currently for in a volunteer capacity, but we do have many other opportunities available. And we have 2 volunteer orientations coming up in August.
Thank you. A little over time, but we're gonna take this live question here from Annie at Cosmo Dogs. So Annie, you should be able to unmute.
Hi, thank you for taking my question. So I want to follow up. I was the one who asked about the stress reduction and a behavior plan. The panels are great. I'm glad that they're there now. However, that's something that we asked for about 3 years ago. But my question was, what is a behavior plan? The panel itself is not a plan. I'm curious about what is the specific plan. Give me an example of a plan as to which dog, how did you do behavior modification? And I want to add, just because a dog is charging and forward, that doesn't mean it's aggressive. And just because it's shaking, it doesn't mean it's only fearful. And a lot of fearful dogs are forward and charging, and that is still fear. And as far as retention concerns, that was again my question, which didn't really get answered. I want to know what behavior resources are given to people who don't feel like they're able to keep their animals because of behavior reasons. Thank you.
Okay, so there's a few questions that were asked. So I'll start with you wanted an example. So let's look specifically at barrier reactivity. Okay, so that could be potentially inside the kennel, barking, lunging, growling at people or dogs that are near, but calm and social outside of the kennel. So what are some of the support strategies that we can do? I talked about the visual barriers, which I'm glad to hear that was something you all thought was a good idea to begin with. We're going to also prioritize out of kennel assessments We're going to toss treats when walking by. Treats are going to come no matter what. Positive association. We're going to also, we have PVC pipes that drop down that go right into the kennel to encourage giving the treats, but avoiding potentially somebody going up and being forward and possibly looking confrontational with body postures or eye contact, so that the dog can focus on the treat, and it's delivered away from the pressure of the person, in other words. And we'll also consider whether foster or alternative housing can be useful. We have 151 dogs here as of today. We can only do so much. We would love to do everything possible, but we are limited, as per what I was discussed in the slides, with our staffing resources, with our medical resources, because we have to provide for every single animal as well as the animals coming in. You can imagine 151 animals is quite a bit. So we have different things that could be for these care packages, excuse me. So staff, actually, our dog team has a packet of different care packages. It could be lack of motivation. It's, rowdy adolescent behavior. We have support strategies for every single one of these care packages that we incorporate within. So there's quite a bit that we can do with that. And then I don't remember the other question. And I do acknowledge what you said about behaviors documented, that it might not be one thing or the other. I agree with you. I'm not saying that these behaviors are the only thing we could see, but we're going to take into account the whole picture. If a dog is actively trying to bite staff, that is going to be considered. We just have to look at it completely. If the dog's fearful, that's why I talked about our FAS scores and how important it is, and providing medication that could potentially be beneficial to them. So we understand we're not going to, that behaviors may evolve, and that it could be a dog that's more fearful than anything, but we just have to look at the big picture. And then the last part of that question, I'm sorry.
It's okay. Mallory, we're actually kind of coming to time. We wanted to give everyone an extra 15 minutes to ask questions through our presentation being a little bit longer. So we're actually going to conclude there. I know there's still some questions that weren't answered, and we'll look to answer those on our next forum date. The topic on that will be PRNS. We will again announce the date for that later in August, but it will be in August, and the topic will be PRNS. We thank everyone for coming out here and being a part of this conversation and asking really good questions. This video will be posted on our YouTube channel this week. Some of the answers in the Q&A will also be included in there as well. Thank you so much, everybody. You guys all have a good night, and we'll see you at the next one.